Dr. Reimer, thank you for coming on and chatting with me for Collab Conversations. I saw the survey that the CMA, the Canadian Medical Association, put out regarding the misinformation and disinformation in health, and thought that was really interesting, especially considering what's going on with the measles outbreak in Ontario and Alberta. Um, and so I would love for us to have a conversation about how misinformation, disinformation is impacting health for Canadians, talk about the survey, and then maybe come up with some solutions if you've got any at the end. And so maybe we could just start. You can tell us a little bit about yourself and the role that you play at the CMA.
Well, sure. I mean, I'm really excited to talk about this. Misinformation is an area I care deeply about. So, I'm the president of the Canadian Medical Association, and I'm a public health physician by training. So, my role before this, I was the VP of Medical Services for the Winnipeg Health Region, and before that, I was the medical director of public health for Winnipeg, as well as being the spokesperson for the COVID-19 vaccine campaign, which made me deeply familiar with misinformation and the impacts of misinformation on, at the time, Manitobans, but now with my Canadian role, really seeing the impact it has on Canadians across the country and just the harms that we see people experience. So, this survey is the second time we've done a survey like this at the CMA, but it's really important to us to be part of the solution. And that means, in part, tracking the problem. And so, it's really helpful to be able to have data points to look at to see how much Canadians are dealing with misinformation and what the outcomes for their health are.
Yeah, and so maybe just let's start with the first or the previous survey. When was that?
Oh, I don't remember off the top of my head where I think it was about a year. I think it's an annual survey, but I'd have to
Okay.
double check because I really delved deep into this current survey as opposed to looking at previous ones. But I do know that between the two surveys, which I think were a year apart, we did see some changes. And normally we expect changes to take, 5 years, 10 years. And the fact that we saw people perceiving to have worsening media environments, worsening impacts of misinformation in just a year over year survey was quite dramatic to see.
Yeah, that's why I was asking. Okay, so let's talk about the recent survey.
Yeah, I think there were a couple of things that really stood out to me and really problematic numbers. There's two stats that to me summarize the issue. The first was that there's two things going on at the same time. There's the fact that there's misinformation, people are being bombarded by it online, whether they're looking for it or not. And at the same time, they don't have access to care. And so when they don't have that trusted relationship with a family doctor, for example, to verify information, to talk about their own health, that's where we see really bad impacts happening. And in the survey, the number that stood out to me was the fact that 37% of respondents said they have no choice but to seek health information online because they don't have access to a doctor. So that's a pretty high number who are saying they're getting their information online. So that's the first chunk of the problem, is that we have these dual crises happening together. But then the second is it actually having a negative impact? And the survey told us that it is, that almost a quarter of people have had a negative health reaction from following advice they saw online. And that's just the people who recognize that that's what happened and are willing to admit it in a survey. So the fact that a quarter of people recognize and will admit that they've had bad health outcomes because of advice they saw online is pretty concerning and means that we need to be fighting both the misinformation and the access to care problem at the same time.
Yeah, 100%. So this lack of information, is that coming from the fact that people are turning more and more to social media versus trusted news sources?
I think that's part of it. And we see with younger populations that they're getting their news on social media, and that is not a trustworthy way to get news. And when they're on social media, they're not necessarily looking for health information. It's really being thrown at them. And most of what's thrown at them, the algorithms, they give more advantage to lies. They spread more easily, they're more dramatic, they get more engagement. And so the algorithms really churn that out. And so when you're just going on social media, maybe just for entertainment purposes, you're still getting thrown stuff like seed oils are bad for you, sunscreen causes cancer, all of these things that are just untrue. But the algorithm promotes those messages because they're easier to get engagement with. And that's really problematic. But then when you don't have a doctor to double check things with, that's even worse. So I don't think that one problem one side or the other is the only problem. I think these are compounding issues.
Yeah. And so do you think this misinformation and this disinformation, and actually maybe I'll ask, like, what is the difference between misinformation and disinformation? And then at the same time, is it affecting a certain population more than other demographics, generations?
Yeah, misinformation and disinformation are sort of two different parts of the same issue. So misinformation is just information that is not true. It's often spread accidentally. People see it online and they think it's true, and so they share it. And so there's no intent really attached to misinformation. Disinformation is intentionally untrue. So that's where people who are benefiting from the lies are either creating them or spreading them, knowing that they're spreading something that's not true. At the end of the day, they both cause harm. And so whether it's intentional or not, I want to fight the fact that people are being bombarded by information that's not true. That's where we really need to be pushing things. And like you said, not everyone is equally affected. We tend to think and perhaps this is us getting it wrong, but we tend to think that, oh, it's the baby boomers who they don't know how to deal with the online stuff. They're falling for all the scams. But when we did our survey, we actually found it was the younger cohorts who were more susceptible to misinformation. So that was a surprise to me. But when I really started to think through it, I guess maybe it shouldn't have been, because the baby boomers, there's been a lot that's been established as sort of accepted truth over many generations where they had consistent sources of information. Whereas for the younger generations, they're getting so many different sources of information sent to them that it can be much harder to figure out what is or isn't true. And the more misinformation you see, the more likely it is that the truth seems like a lie. If you over and over and over again see stuff telling you that you shouldn't eat anything that has ingredients that you can't pronounce over and over and over again, then me telling you that, some of these things are actually perfectly healthy to eat may start to look like a lie in and of itself because you're so used to seeing the untrue things.
And so, because I mean, social media is geared towards a younger population, and so are they the ones who are more susceptible to the misinformation, disinformation?
That's what our survey saw. So we actually asked in the survey a bunch of questions that were sort of typical beliefs in things that weren't true, and tried to rate how people scored on that. Things that we knew that were not true, and then tested the survey respondents about what their perceptions were, and found that the younger cohorts were worse at recognizing true and false information than the older cohorts. So like I said, that surprised me, but I think in retrospect, maybe it shouldn't have, based on the information environment that they have available to them. So it was stuff like asking about like chemtrails in airplanes and whether or not those are intentionally harmful to humans, and questions like that. I've just found that the younger populations were more likely to believe the false information.
Yeah. And so you talked about how, like the repetition of the false claims or the misinformation, or is that the only reason that they're more susceptible?
They also are less likely to use trustworthy sources of information. So traditional media, they'll get stuff wrong. I'm not trying to say that every report you see out there is true. In
Mhm.
fact, I teach in the medical school about how to recognize when things are being manipulated to be a flashier headline. You can use things like relative risk instead of absolute risk to say like, oh, it's, 300 times riskier to take substance A compared to B. But if neither of them are risky at all, who cares if it's 300 times more risky? So we talk about how do you recognize these flashy headlines that are intended to mislead. But I will say that traditional media, overall, they're trying to get it right. Yes, they want clicks, they want flashy headlines, but they don't tend to outright lie. Whereas on social media, there's no rules. You can put out whatever you want. And so there's nothing stopping people from putting out things that sound true with absolutely no need to back them up, because their only goal is to get clicks. Their only goal is to get likes. Their only goal is to get people buying in on what they're selling, whether that's the misinformation, or they might literally be selling something. They might be selling a supplement or a diet regime or something like that.
Yeah. Well, on my social media, I'm a woman of a certain age. And so all my social media is flooded with
Yeah.
perimenopausal supplements and how I should be working out and what I should be eating and avoiding and don't drink coffee before you do this. And so I mean, I'm not asking for it, and that's all I'm getting. And it is actually really overwhelming.
And it's hard to figure out if you should believe any of it. And especially if you start to see similar things over and over again. Most of the time, they're trying to sell you on some sort of exercise regime, sign up for my class or whatever it may be. And so there is no one exercise regime that is best for perimenopausal women. We do know that weight bearing exercises are better for perimenopausal women. So doing some weightlifting is very healthy. That's about the extent of what we can say. Some cardio, some weight bearing, but the people who are out there telling you like, "Oh, this is how you target your belly fat and this is what your metabolism is like and these are things that will boost your metabolism." When someone says something's going to boost your metabolism, I just want to ask like, what is metabolism and what does it mean to boost it?
Yeah.
Because these are medical-ish words that people use to try to sound like they know what they're talking about. And it's hard not to believe them, especially when they have people who look like they're demonstrating the effect.
Yeah. They're all trying to sell you something.
Yeah.
100% of the time they are selling you something.
And sometimes they're just selling you themselves because
Yeah.
if they can get enough likes and clicks and follows, then they get ad revenue. So you're not always the one who's directly paying them, but they are always trying to sell something so that they
Yeah.
can make money.
Yeah. It's I think that especially with the new administration in place in the US, I mean, they used to have like these fact checking and these regulations around all that, but since the new administration, all that has gone away. And so um, it is really playing a huge part in increasing all that
Yeah. Yeah,
sensationalism
and
junk.
but misinformation doesn't respect borders. So it's not like what's happening in the US doesn't impact us in Canada because it does.
Yeah.
I just saw
Yeah.
a clip of RFK saying that thought something was concerning because it had riboflavin in it because he couldn't pronounce riboflavin.
Yeah.
Riboflavin is just vitamin B2. It's just the scientific term for a vitamin B. And so, yeah, okay, it does sound chemical. Everything is chemicals. Water is a chemical. But those are the types of little bits of misinformation that lead people down a path to natural eating or, there's nothing wrong with trying to eat less processed food. In fact, we know that eating highly processed food is overall worse for you. But these whole natural eating approaches really take people down this road of starting to buy the supplements that who knows what's in those. We don't, that's not regulated. So you could be taking anything, could be water, could be harmful. We don't know. And it really gets people down this trail of misinformation that can really grasp them.
Yeah. Well, interesting that you brought up RFK because I did see in the survey that there was not a lot of trust, surprisingly, not a lot of trust in scientific studies.
Hmm. Yeah, I mean, science is hard and it changes. And that's what makes science great is that we're always trying to learn. We're always trying to just disprove ourselves in science and expand our knowledge and our understanding of things. But if you're not deep in the science world, the fact that we change our mind on things can be very hard to follow and confusing. And so I certainly understand why people feel frustrated or confused or look for simpler answers. When the scientific studies give you these complex answers that are always, there's all these caveats being like, well, it was only this one population in this one place, and we don't know if it applies to you or not. That's not giving people the answer that they're looking for in that moment. It's much easier to follow somebody who says, this is how you need to be healthy. Here's the simple, easy answer. The simple, easy answers are rarely the true answer, but they are very tempting to follow. So I understand why people want to go that way. What I think is unfortunate is that we have this mistrust in experts and that
Mhm.
there is an active attempt to drive that mistrust. That is something that people are intentionally trying to undermine trust in institutions and in experts. And I always think of the example of like a pilot in a plane. Like nobody's questioning whether or not the pilot knows how to fly a plane. You just blindly get onto a plane. I don't know how planes work. I fly all the time. But I do it because I trust that there's an expert who has done the research. And, I'm not going to go and do my own research about what, elevation we should be flying at or whether we should go up or down when there's turbulence like that. We don't do it in that circumstance. So why do we do it with vaccines?
Yeah.
Why don't we trust the people who have spent their whole lives diving deep into the science to understand all the knowns, the unknowns, it gets very frustrating for me to see the intentional undermining of trust in institutions and in experts.
And do you think that I think that that always existed, but it feels like it's been exacerbated since the pandemic.
Yeah, it's anytime you have a major traumatic event for a group of people, you're going to get some changes in how we structure ourselves, how we communicate. We saw that coming out of the Spanish flu 100 years ago, and we went into, there was the Great Depression right around there. So when you have economic instability, then you also tend to have mistrust in institutions. And so the fact that we've had, the 2008 economic issue, and then again now we have this affordability crisis. These things together with the COVID pandemic, those tend to decrease trust in institutions and lead people to have a backlash against the status quo.
Yeah, which is unfortunate because, we see that all this vaccine hesitancy around the pandemic and how that is now translating into this measles outbreak. And, on the news today, they were talking about in Alberta how there are now 210 confirmed cases of a previously eradicated disease.
Yeah, we had eliminated it from Canada. There was no measles in Canada. We did that in the 90s. It was really exciting to see that measles was gone. And now we have large outbreaks in happening at least two, maybe three to four provinces, bigger than the one that's going on in the US. The one in Texas is getting a lot of attention, but the one in Ontario is far larger than the one in Texas. And this really is almost exclusively happening in unvaccinated
Mhm.
populations. But that doesn't mean it doesn't also put vaccinated people at risk. The vaccine's incredibly effective. It's 97% effective. That's not 100%. And so even, there's going to be that 3% of vaccinated people who are still at risk, and we don't know who that is. And so it's hard because it's hurting, most of all, it's hurting the people who aren't vaccinated, the people who have been duped into believing that the vaccines are harmful to them and now can have serious lifelong health consequences from measles. But it's also harming people who have done everything that they could have done to follow the science, because some of them are going to get sick as well.
Yeah. And I think when you lay it out that way, because I was just thinking about it from the perspective of the people who haven't been vaccinated, and it could be fatal to them, but um, it's also putting people who have been vaccinated and who are doing all the right things at risk as well. And so there in the survey, there was one of the slides was about the trusted sources of information. Do you want to go into it a little bit?
I think this was one of the more encouraging parts of the survey, in just seeing that despite how it feels like a lot of this trust is going down, and it has gone down, that it's still quite high when you talk about individual practitioners. So physicians still maintained 80% level of trust from survey respondents, and that's quite high. Politicians, I don't remember off the top of my head, but they're way, way lower than what we saw for physicians. And so that was still really, really encouraging to see that there is still trust in healthcare providers. And even when we looked at Health Canada or the Public Health Agency of Canada, they were both above 75%. So still a lot of trust in Canada for those trusted institutions. They've gone down, they used to be higher, but still really good. And that made me feel some, encouragement coming out of this study. We did see, political leaders were down at 33%, which I guess that's not shocking. There's never a huge amount of trust in political leaders, and I understand that's always tricky because they're always the way our democracy is set up. This isn't a criticism of the politicians. They have to win elections. And so they have to do and say things that get them votes. That's the job. Luckily, physicians and nurses don't have to do that. We can just stick to honesty, scientific fact, and we got more than enough work. There's no reason for me to lie to people to try to get more work. So happy to have people come in and share with them accurate information.
Yeah.
But I still think that that was encouraging. One of the most interesting things about trust that I saw was there was a big difference between trusting Canadian versus American news organizations. And this survey happened, I think it was after the election, but before Trump actually came into power. I think it was like December. And so I'd be interested to see if that has gotten even worse, because I expect it may have gotten worse. But very interesting to see that Canadians still had much more trust in our own news organizations.
Yeah.
Still not that high. It was still like 60%, but
Yeah. Well, I think CNN was something like 27%.
oh, I
I
don't remember
don't
off the top
remember,
of my head.
but yeah, it was
Yeah.
really low. It was surprisingly low. I mean, not surprising, um but I did find it interesting to see how the like Health Canada and healthcare providers and even patient advocates or patient groups were also on the list. And it was, I think the patient groups were at 68% trust. And so I mean, it's silly, but are we like the healthcare providers, the professional organizations like CMA, Health Canada, should we be the new influencers on social media? Because this is where people are getting their information from. So should we be thinking about ourselves as doing that or as becoming that?
Yeah, I think so. I think two things when it comes to combating misinformation. One is that we need to have just outside of social media trusted sources of information. So having Health Canada or the Public Health Agency of Canada or Diabetes Canada or the Canadian Cancer Society or websites like that that serve as a backbone of trusted information. We need to invest in those and make sure that that is there for when people are actively searching for information. So that doesn't fight the misinformation that gets thrown at you in social media, but it does help when you have a question, when you're trying to look for answers, to make sure that we have trusted sources of information available as a backstop. But then I also think that we need to be in the spaces where people already are. And so that means that the CMA needs to be on social media. I'd like to see Health Canada or Public Health Agency of Canada being on social media. We have at the CMA a platform called Healthcare for Real, which is we're on YouTube and TikTok and Instagram and Threads and I think Blue Sky. I don't know if I'm missing some, but it's they make videos and content, and they have a website talking about the healthcare system. So it's not about any specific health topic per se. It's more about the system to help people understand, why is it hard to get a family doctor? Why do you have to wait in emergency rooms? We even have videos about like, do doctors still wear white coats? So having that in the spaces where people already are so that it does come up in their feed alongside the misinformation can still be very helpful. And so patient-led organizations who are there talking about diabetes and pointing people to Diabetes Canada as a source of information, but also letting them know, like, what does it mean to have high blood sugar and what are the possible health outcomes and what works well? And, is it just because of a bad diet that you got diabetes? No. These are also really great to be in those spaces. But keeping in mind, no matter what we do, it is always easier to spread a lie. And so I don't think we're going to win this battle unless the social media algorithms change, which they could. The companies have the power to change them. They could today privilege accurate information over inaccurate. But unless they do that, I don't think we'll win, but that doesn't mean we shouldn't still be there trying to make a difference the best we can.
Yeah. Oh, okay. So two questions then. First, well, maybe not a question, but just a comment on the Cancer Collab website. I did find the CMA's Healthcare for Real, and I did start a section on cancercollab.ca about like where you can get trusted sources of
I love
information.
that.
So we didn't write it, but you should read it is what I called it. And so I did link back to the CMA's Healthcare for Real. But then just on the social media where they do have the power to change the algorithms and make sure that there is at least people are not spreading lies, like as a base minimum. So does the CMA have any plans to work on this, advocate to the government? And I know like a lot of them are not Canadian companies, and so it's a little bit more challenging. But I think that there is a lot of interest, and not just within Canada, but globally, to stop this
Yeah.
misinformation, disinformation.
Yeah, and we have to be doing it in collaboration with, maybe at the national level it would have an impact, but even beyond, like a lot of the research shows that, all of Europe needs to do this together because if you just have one country going on their own, it can be very challenging. We saw, for example, when Canada created the law that you had to pay to use Canadian news sources, well, that kind of didn't turn out the way we were hoping, in that Meta just stopped allowing us to access news, Canadian news, on their platforms. Although you still can on Threads, which I find interesting. But that that was definitely not the intended outcome. The intended outcome was to support the people who are developing the content. And so we need to be cautious about how we do things, but also I think it's totally fair to get together with maybe us and Europe and come up with how we expect these platforms to work if they're going to function in our countries, and come up with a consistent approach to say, you have to have fact checking, you have to have different parts of these safety nets to make sure that we aren't harming people with
Yeah.
our social media platforms.
And especially as it relates to health, because I mean, you can have misinformation, misinformation, disinformation exists across everything. But I think especially as it relates to health, it's so important because, as you said, like a quarter of the people who are going online are having a negative impact.
Yeah, there is, like you said, there's tons of misinformation. I remember right after the Ontario election that there was all this stuff saying that Doug Ford had gone to Florida and taken a trip to Florida. I believe that's misinformation because they've looked to see, and there's pictures of him in Ontario at the time that people said he was in Ontario or in Florida. And I mean, okay, that's probably misinformation, but is it harming people if they believe Doug Ford is in Florida? I guess it's harming people in that it's a part of that undermining trust in institutions,
Mhm.
but nobody's making a health decision based on that. Probably not the end of the world. I don't want people lying about our politicians, but you're right. It's different than if they're saying, don't take insulin because it's bad for you. Instead, take this natural substance that's going to control your blood sugar, and it doesn't.
Yeah,
You know,
and don't
that
wear sunscreen.
Yeah, like don't take your cancer medication because it's a poison. Well, most cancer medication is poison.
That's why it works.
Yeah, so, telling people to avoid seeing their doctor or avoid taking treatment for their condition, that's a whole different level of mis or disinformation that has direct harms on individuals.
Yeah. And so what are the next steps for the CMA based on the information that you've gathered? Like what are you going to do about it?
Yeah, we're going to do a number of things. So we're going to keep doing the survey for starters because we need to track this and make sure that people can see what's happening. We're going to keep things like healthcare for real, keep being in the spaces where people are. So if anything, we want to expand and have more information, more videos. And on social media, that means you have to constantly be generating content. It's really not a periodic thing. You really have to, if you want to get to people in the algorithm, you have to be consistently putting out content. So that's something we want to keep doing. We're also funding traditional media. So we have funded with Canadian Press health reporters. We don't control what they report on. We have no editorial control at all, but we do provide them funding so that there are health reporters who are out there putting their absolute best effort forward into producing accurate health information for media outlets, traditional media outlets. And that's really critical. We also have been funding an Indigenous health position reporter as well, because that's a really underfunded, underreported area. So all of these things we will keep doing, and we will keep working with government to push them to try to regulate things and create healthier environments, and for them to also appropriately fund Health Canada, the Public Health Agency of Canada, so that they can remain and, if anything, grow in their being a trusted source of information for Canadians.
And is there a role for patient advocates or patient
Yes.
groups?
Well, like you said, so they're listed, they're 68% trust. I mean, that's still higher than a lot of other parts of our survey. Like when we even looked at journalists, they were just below 50%, and news organizations were 58%. So having those organizations, and especially if they're partnering, so if your organization's partnering with the Canadian Cancer Society and making sure that people know that these are groups who have your best interest at heart, and they are going to commit to finding you accurate, trusted, evidence-based information, that's really critical. But the personal stories are powerful. Personal stories will impact people more than any amount of stats or data. One of the stories that I tell about misinformation that seems to impact people is this year I was working at Women's Hospital, and we had a patient there who had had a postpartum hemorrhage, so bleeding after having a baby, needed a blood transfusion, but she declined the blood transfusion because she didn't want to receive vaccinated blood. This is a true story of somebody who was trying to make the best decision for herself, for her family, and it became a life or death situation because of misinformation. And people with cancer can also tell their own powerful stories about how a treatment saved their life, or how maybe there was some misinformation that led them to make a decision that hurt them, or there's a lot of those personal stories that are going to impact people way more than me saying 23% of survey respondents have had a negative health outcome because of following advice they saw online. That's true, 23%. But saying that we at the hospital had a patient who declined a blood transfusion, that is a more powerful tool than the stat.
Yeah. And so, I mean, how do you manage those types of situations where, like you said, it's life and death, and like this is misinformation that is making you like you think you're trying to do the best thing for you and your baby, but it's actually a life and death situation. So how do you manage this
Like as the provider or as the person?
as the provider?
Yeah, so the number one thing I tell people is that, you know, empathy is the most important thing you can bring to that interaction. We always think as healthcare providers that it's our expertise that is the most important, and it is. You have to have expertise for sure. But what patients tell us is that empathy is more important than expertise. They need to have a healthcare provider that they feel actually cares about them, feels actually has their back, has their best interests at heart. And so if you go into an interaction like that and make someone feel stupid, or make them feel like you don't care about their opinion, or that their experience doesn't matter, they will shut down, they will push you away. You will never convince them by just coming in and spouting stats at them. It is far more important to meet them where they're at and say, obviously, you love your baby you just had, and this is a scary moment for you, and you are trying to make the best decisions you can. Can I talk to you about, some of my concerns and some of the evidence behind it? Like if you start from that point of like, I see you're doing a great job putting your family first. I also want to put your family first. Let's talk about, can I bring some information into this conversation? That
Mhm.
is just so much more effective than like, you're going to die.
Yeah.
Like, what are you doing? That's a myth. Like, just going in and saying, like, that's so stupid. Why wouldn't you want vaccinated blood? That doesn't even mean anything. What do you think is in the blood? Like, approaching it, even if you don't use a tone like that, even if you use a nicer tone, if you go in and that's what they hear is like, you idiot, you've lost them.
Yeah. And I think empathy is a really important part of that healthcare provider patient relationship, regardless of if it's like a misinformation or a
Yeah.
disinformation.
And we've all had stories of like where we tried to talk to our doctor and they like poo-pooed us or brushed us off, and we left feeling like completely unheard and undervalued. And like you think about how you felt in that moment, what's the likelihood that you're going to listen to them
Yeah.
when, even if they, whether they were right or wrong, if they brush aside your concerns, like,
Yeah.
yeah, we're not going to listen.
And so is that something the CMA is also tackling from like a different perspective of tackling this problem because that relationship between the healthcare provider and the patient, like if that relationship exists and there's trust, it's also going to lead to less likely
Yeah.
believing those TikTok videos.
Yeah, so we're going to work really hard to try to make the system better so that people have access to care. Because the fact that 6.5 million people don't have a family doctor right now in Canada is hugely problematic. Forget whether or not there's empathy. If there's no access at all, then we can't even get to the discussion of whether or not you're being empathetic. You don't exist to that person. And even people who have a family doctor, what's the likelihood you can get an appointment quick enough to get your answer to whatever health issue you're having at that moment? I mean, I've had that myself where, like, right now I have a knee injury and I'm like, how do I get to see somebody and get this answered? I'll just deal with it. Maybe I'll Google it and figure out what to do. So while we have all this conversation, what are we going to do about misinformation? The CMA also needs to be advocating very hard to all levels of government to make sure that they're making decisions for the healthcare system that make it better for Canadians. And both of those avenues we have to work on at the same time.
Yeah. And
And the
then
med
I guess,
schools need to work on the empathy side. The med schools need to be teaching med
yes.
students about how to talk to patients, and they are. That was training that I got, particularly in residency. I got taught a lot about empathy, and so we know that that's happening, and we need to keep encouraging that type of medical education.
Yeah, I think that that's going to be really important, especially the way that that relationship has evolved, where it used to be like the doctor was the expert, and you didn't say "mom" when the doctor
Yeah.
spoke, and now that relationship has changed a lot. But what role does government have in all this? I mean, like Health Canada, yeah, like highly trusted, but like what role? Because it's not just Health Canada, and like you said, we do have a lack of trust in our politicians. So what role does government play in all this?
I think they need to do a number of things. So we talked about regulation, so that is important, and I think they need to work with other countries to have consistent approaches to how social media is regulated. I want to see them investing in the communications budgets for things like Health Canada and the Public Health Agency of Canada so that they can be in traditional media, on social media, on websites. Health Canada actually has great information on their website. It's not the easiest website to navigate, but there is actually pretty good information on it if you can navigate it. So I'd love to see more investments into making it a more user-friendly website because there's, they've put a lot of effort into developing content for it. And so that's something that if we keep investing in, I think can be a very helpful tool for Canadians. And then I want to see them working on the access side. So that means investing in team-based care. So you don't just have these solo practitioners, whether it's the family doc or the pharmacist or the NP. We don't really want them off on their own. Instead, we'd like to see them working together, sharing health record and sharing expertise. We want to see them reducing administrative burden so we can spend less time on paperwork and more time caring for patients. There's a lot of different investments that some of them cost money and some of them we're just talking about reorganizing things. The last federal government introduced a bill on what was called interoperability. I don't think the term matters that much, but the idea is the bill would have required the people who make health records, electronic health records, to share patient data across platforms. So
Mhm.
that if I'm in the hospital, I can see what happened in the clinic and I can see what happened in a different hospital, which is not the case right now. And so we've had very serious outcomes. There's a patient advocate right now who speaks on behalf of her brother's experience because his prostate cancer, the diagnosis got lost because it was physically faxed and the paper fell under a cabinet. That shouldn't happen. And so I want to see the government create rules and regulations that say, no, we have to share information across platforms. Nobody should not know about their prostate cancer diagnosis
Mhm.
just because we can't see things across systems. And that's not a particularly costly intervention. It just requires some political will.
Yeah, and that was actually going to be my very next question. What role do electronic medical records play in all this? But
Yeah, huge. Yeah. Like the reason that it's the sister who's advocating is because that patient died. His prostate cancer got diagnosed early enough that potentially, I mean, you never know, but potentially there could have been intervention that saved his life. But because he didn't find out for so long,
Mhm.
his cancer progressed. And maybe, we don't know, we never know, but maybe we could have saved his life if we had just shared information across systems. The
Yeah.
information existed. The diagnosis was in somebody's system, but it just didn't make it into the family doctor's electronic record and didn't make it to that patient. So we also need to advocate for patients to have access to their own data. It's
Yeah.
not just about having the providers be able to see everything, though we want that also. But patients should be able to see what is going on in their own life and their own body.
Yeah, absolutely. And I think, in Quebec, um, we have a website called Carnet Santé where we have access to our own data, but it takes 30 days from the day that the clinician saw the data for you to be able to access it. Huge. But what about AI?
Oh, that's a great question because I actually think AI has a lot of potential in healthcare and in the misinformation space. In the
Mhm.
misinformation space, it could go either way depending on how we regulate it and what we allow it to do. AI tends to rely on more reliable sources of information when it's producing its answers. So it's better usually than just a Google search or whatever because of the way it does seem to privilege the more accurate sources of information. However, it also hallucinates, meaning it makes stuff up. So, you know, I would say I think right now it's probably a net positive on the misinformation side because it does most of the time go to good sources of information to get its answers, but it sometimes makes things up and sometimes still gets stuff wrong because it's complicated. And I saw a post from a dietitian about how it mixed up, two different types of sugar when it was giving an answer about what was in formula. And so it was giving bad information just because it was a small technicality that you really needed an expert to be able to tell you, like, no, this formula is fine because you misunderstood what this sugar means.
Mhm.
So currently a net positive, but that, if it starts using less trusted sources of information, if the sources of information are becoming less available, that could move that needle in a way that's harmful. And then the healthcare space, it's the first time I've seen technology that might actually remove barriers between the physician and patient relationship. Because when we had electronic health records, we went from talking face to face with me jotting notes, in front of me, to me sort of turning to the side to type on my keyboard and looking at you occasionally. And that's not ideal, the fact that we're typing while we're talking and not looking at the person in front of us. And now we have these options with AI where it listens to the whole encounter and then it summarizes in a note. And theoretically, it could produce a version for the patient as well, which is going to be a little different than the one that goes into the health record, but hopefully is easier to understand. So
Mhm.
I think there's a lot of potential there. It can't replace that relationship um, because it's a tool, but I think it can augment what we can offer. And so I do have a lot of hope that it is something that's going to help.
Yeah. I mean, it can be used as a tool to fight the misinformation and disinformation.
I think, yeah, it can be used to fight access and it can be used to fight misinformation.
Yeah, amazing. Okay, so then just one last question. If for people who are listening to the podcast and are, well, how do they make sure that their sources of information are accurate, or they make sure that they're getting they're not being pulled into this misinformation, disinformation? What advice do you have for them?
Yeah, I would say go to sources that you know are going to be using evidence-based information. So the Canadian Cancer Society is a great example, or the Diabetes Canada, or sources like that where the whole reason they exist is just simply to be a source of information for people. They're not selling you anything. If there's something, a website or a social media, whatever, that's trying to sell you something, I'm not saying that the information they're giving you is bad. It might not be bad, but I would certainly be a lot more skeptical and look for some of those trusted sources where the whole intent is just to help people. I think the patient advocacy groups are really good. Sometimes, though, we, even as patients, and I'm also sometimes a patient, we can take each other down rabbit holes. And so I want to be really cautious that even as patient advocates, that we work together with uh, those evidence-based sources of information. That said, sometimes we as physicians can discount patient experience and patient expertise and discount some options that actually can be really helpful. So I think it's really important to have the patients and the providers working together to come up with sources of information and best evidence, because some evidence comes from medical trials and some evidence comes from people's experience, and both of those are important.
Yeah.
And so I'd really like to see us do a better job at bringing both of those voices into the conversation together.
Yeah. Well, thank you so much, Dr. Reimer, for your time. It was a great discussion. I can't wait to put this out because it's such a timely conversation to be having. And hopefully, when you do the survey again next year, there will be some change, but in the right direction.
Yeah, I mean, that's certainly the hope. I think with what we're seeing south of us, we've got a uphill battle to face right now. So I don't know if things are going to go in the right or the wrong direction, but I do know we need good people to fight and make sure that we're doing everything we can to support Canadians.
Yeah. Thank you so much.
Yeah, likewise. Thank you. This is really great. I'm really glad that you're doing this to reach out to people who are going through the system and just giving them that opportunity to hear from different people with different expertise. So it's really appreciated.
Yeah, my pleasure. I think that this is so important.